In this issue of Clinical Infectious Disease, there's a paper written on charting the future of infectious disease, addressing the mismatch between supply and demand. And I'll hear with the authors talking about what the paper says. So why is there an issue? Why are we concerned about this mismatch with the infectious disease and the HIV workforce?
Great, thank you, Carlos. Since 2010, we've seen a diminishing supply of people interested after completing residency in the field of infectious disease. That is concerning to us because all evidence demonstrates that we are actually going to need a more robust infectious disease workforce to address the challenges that lie ahead. And I would say that for several reasons. First, we know that infectious disease involvement in the care of some of these patients improves their outcomes. It is also the case that we are using immunosuppressive drugs in more patients for more diseases, chemotherapies, suppressive agents for transplant, increasing transplant, as well as biologics for a variety of diseases. We need a workforce able to handle the complications and infectious outcomes that result.
So Wendy, if it's such a need for infectious disease, why aren't there more trainees going into infectious disease?
Well, Carlos, that's really important to understand because if we're going to propose solutions, we need to understand the reasons. And so my colleague Erin Bonura at Oregon Health Sciences and I conducted a survey of graduating residents about why they chose the specialty they chose, and in particular, if they did not choose infectious disease, why not? And there were really 4 things that came out of that, 4 suggestions that would have made residents more interested in infectious disease. They cited an interest in having earlier exposure to infectious disease and a better exposure to the breadth and depth of the specialty. There are so many career options, but students and residents often don't see that in the limited scope in which they work. They cited more opportunities for scholarship and mentorship in order to develop research foci and have a more in-depth experience with the field. They also talked about concerns about job availability, and that's not only job availability going out into private practice after graduation, but also is it viable to have an academic career, a research career, a public health career, other types of careers in infectious disease in the current state. And then lastly, there clearly was a concern about salary and compensation, particularly in this era where there is such a high debt burden among our students.
So I'm going to pick up from there and just ask you, in the paper, there's specific policies and solutions that are proposed. Can you talk a little bit about those?
Sure, I can. I think the first thing to know is there are a lot of things underway that address some of those factors that I just mentioned to you. And those include things like reforming our medical education preclinical curriculum in a way that exposes students to the new and emerging topics like the microbiome, like antimicrobial resistance, but also engages students with a more innovative classroom structure than has been done previously. So I think there's some really exciting things underway, but in our paper we talk a lot about policy issues on a broader scale, which I think are really important. And Rochelle, can you comment on some of those?
Right. So I think we do need to be present and active at the federal level in order to move some of these policies forward. These policies include infectious disease as a qualifying specialty for the National Health Service Corps, especially for those who will provide HIV care, a promotion of research opportunities at the NIH level. So currently T32s, we really do need to expand those T32 research training opportunities, as well as likely to expand their duration. Currently they're limited to 2 years, and it is really critical that they be extended to 3 to provide people the time that they need in order to successfully navigate the T to K transition. There are key public health issues as well, and I'm wondering, Carlos, if you want to close with those.
Yeah, without doubt, infectious disease and public health have been linked all along, and we see outbreaks continuously, whether it's Ebola or Zika or influenza now. And therefore, we need to be sure that people continue entering from ID to public health. We need to ensure that there's loan repayment within public health, that there's adequate salaries within public health, but really that we have a continuous ongoing public health funding that ensures that a workforce doesn't get deployed or looked for when there's an outbreak, but actually outbreaks can be addressed before they happen or start, or before they even start. I want to close and invite everybody to read the paper, but also to help us address this and to send your comments. The authors are delighted to hear what proposals are there, and they're working very closely with the Infectious Society of America to precisely address these challenges. Thank you.